Hi friends, it's Bob Wilford again. In preparation this week for teaching the abdominal examination to our first year students. As was the case last week, I hope you'll once again reinforce the importance of hand hygiene before they touch a person. And also repeat, please, that I want them to automatically be examining from the right side every time so that variations in their findings come from pathophysiology and not from technique. Please also pay particular attention to draping and modesty. I'd like it if you worked with students so that they looked, listened, percussed, and palpated in about that order. When they're looking, I'd appreciate it if you first made them give words to their Augenblick, the general sense they might have about whether the patient in front of them is basically well or basically in trouble. I'm asking students to name how it might be that they generate a sense about whether or not a person needs more immediate attention than that which they can give them. Please describe for them landmarks. Please ask them to name any skin findings that they might identify, if only to build vocabulary. I don't have any unusual or special requests in mind as I ask you to teach them auscultation techniques, and I think that percussion of the belly to assess liver span in the midclavicular line and to see if there might be splenomegaly are also pretty consistent from provider to provider. Feedback from students in the past that when there's big variation from provider to provider in terms of how they're taught, it's confusing. So when we're teaching about palpation of the liver, please don't come up inferiorly to get that liver edge, but let's all teach the hooking technique coming from above. Thank you. Alas, I had to put the cat down. Please know that bimanual examinations and checks for hernias will come later in the year. Thanks for the work that you're doing on behalf of our students.